We're going beyond words to share the latest trends and to show you how we're solving your toughest challenges. Today, we're talking with Jim Schneider and Bill Stewart of COMS about the integration between American Health Tech and COMS Daylight IQ, and we want to share with you the benefits it will bring to your organization. In a joint effort to reduce rehospitalizations, AHT and COMS have had an integration for years. But based on feedback from our customers, we've taken it to the next level with a deeper, richer integration that really addresses the business challenges of today. Jim, you've spent a lot of time with our customers. Would you talk a little bit about those challenges?
Absolutely, Teresa. Thank you. Our customers are faced with an extremely challenging situation of having to manage higher acuity patients and residents every day. No matter the setting, no matter skilled or long-term care, the skilled nursing facility is only going to get high acuity. And their ability to manage that is absolutely going to control their financial viability as well.
And you know, Bill, when we think about that, that puts increased pressure, workload on the clinicians, right? So what are we doing to help those clinicians make better decisions and as a result have better outcomes?
The responsibilities on the nurses today just increase. The complexity and the acuity of the patients going up. And it's really imperative upon us to deliver a solution embedded within AHT that allows for a cleaner, easier workflow for the nurse.
So Bill, can you talk a little bit about how our integration has improved the workflow and the documentation for the clinician?
So we've taken the benefits of the EMR and the benefits of the disease management system and really brought those two together to streamline the workflow. The initial feedback from our development partners has really been that workflow has dramatically improved and at the same time reduce any kind of double documentation that they would have normally seen in the system.
And so that reduction in documentation in two systems, right, having everything at their fingertips, really does result in better decision making and ultimately better outcomes. Would you agree?
Absolutely. We're a standardized disease management process, and what we're trying to do is bring those standard processes to the bedside.
So Jim, we've been talking about how important reducing rehospitalizations is to our customers, right? Can you talk a little bit about how our integration enables that reduction?
Absolutely. So a key point of reducing rehospitalization in the SNF is getting the nurse to follow standardized processes. Our system is focused on standardized processes to manage chronic disease. The integration of our two systems is going to enable the nurse to follow those processes much more effectively and have every component of the data, the medical record they need to do that.
And Teresa, I'll just add, part of our process is really identifying early onset changes in condition and supplying to the nurse in real time clinical interventions that help to really improve patient care at the bedside.
You know, Bill, that's a very important point because we all know the faster we can recognize a change in condition and address it, the better outcome we'll have, and also that's going to reduce those rehospitalizations. So Jim, there are clear benefits for the clinician with our integration, but let's talk about the director of nursing. She has a really tough, challenging job. What about him or her? What are the benefits to them?
That's an excellent point. And it's very critical within these facilities that we enable the higher skilled nurses that are many times away from the bedside, the directors of nursing, the assistant director of nursing, the supervisor. We enable them to monitor the frontline nurses to see how are they performing. Are they responding to these clinical changes in condition? That's an absolute critical point to reducing hospitalization. Our integration is going to make it much more efficient for the directors of nursing, for even the corporate staff to monitor these frontline nurses to see that they're responding accordingly and picking up subtle changes in condition and reducing readmission.
You know, Bill, it strikes me that this integration can help our customers actually bring a clinical differentiator to the table when they're negotiating for referrals from hospitals. Think about it. They can describe their entire disease management process, the outcomes that result in that, and then also reduce rehospitalizations. Would you agree?
Absolutely, Teresa. It's all about outcomes today, and our joint solution, that's what it delivers.
Jim and Bill, thanks for joining us today. And when you're ready to achieve better care and reduce your rehospitalizations, contact us to hear more about our joint solution.